From proton therapy to advanced clinical trials, all the way down to the honest and open doctors who care for our patients. If you've seen our program before, you already know there is some pretty incredible work happening at the University of Kansas Cancer Center. And that work continues under new leadership. Good morning. It is Tuesday, April 4th. I'm Jessica Lovell, and welcome to the Morning Medical Update. Today, we are meeting the new physician-in-chief at KU Cancer Center. We'll learn what that job entails and what he wants to see happen as cancer research and treatment gets better and better. But first, let's get to our morning rounds, as spring means severe weather season is on its way. Kansas City avoided bad storms last week, but there's another weather system headed into our area, and it's just that time of year. So we want to highlight the best advice from our own experts. Dr. Bryan Beaver specializes in emergency and disaster medicine here at the health system. Dr. Beaver, good morning.
Good morning, Jessica.
Good to have you. So we know what's coming. What injuries do you most often see after a severe weather event?
Absolutely. A 2018 study showed that about 90% of the injuries we see after a tornado are soft tissue injuries such as lacerations and abrasions. So cuts are the biggest thing. Biggest thing we want to make sure we take care of is that those don't get infected.
So as we know, we think we're prepared until something actually happens. But is there anything specific that may not be on our list or front of mind, especially from a medical standpoint, that people should be thinking about?
Definitely. One of the common things that gets forgotten when people go to the safe place in their house is they actually forget their medications. So having those medications in a place where you can quickly grab them as you're heading down. And then also, if you're a patient that's dependent on any sort of medical device, particularly those that require power, that you have a backup power source available.
And what about clothing and shoes? That might not be something people think about in that emergent moment, but when we're talking about debris that you may have to walk around in, that can be an issue.
Either taking to your safe spot or having already in your safe spot, particularly shoes, good closed-toed shoes. If you have to walk through any debris, that's where we actually see a lot of the injuries happen, are going through debris.
Dr. Beaver, anything else that we should be thinking about as we head into this time of year? We've seen other areas of the country. It's been devastating, and how can we best prepare ourselves?
Absolutely. Number one is to have a plan. Know where you're going to go in your home, know how you're going to take shelter. Know that when you're outside at picnics or golf outings or sporting events this time of year, lightning is always a danger. Make sure you know where you can get to stay safe under shelter.
Dr. Beaver, thank you so much. We appreciate your insight.
Thanks.
Joining me now are a few world-class cancer doctors. Dr. Jeff Holzer specializes in urologic cancers. He's sitting right here dead center. How are you?
Good morning.
Good morning. And as of last month, he is the new physician-in-chief at the University of Kansas Cancer Center. We're also joined across the table by his boss, Dr. Roy Jensen. He is the director and vice chancellor of KU Cancer Center and an expert in cancer biology and pathology. Good morning to you.
Good morning.
Good to have you at the table. And joining us remotely this morning is the guy who used to have Dr. Holzerlein's job. Dr. Terry Suey is the former physician-in-chief at the Cancer Center. He specialized in head and neck surgery here at the health system. Dr. Suey, how are you? Are you enjoying retirement or semi-retirement?
Yeah, more than words can say. It's been a great transition.
Well, we miss you, but we're so glad you're with us this morning. Dr. Jensen, kind of help us understand the hierarchy here, because you're the Cancer Center director, but what do you expect from your physician-in-chief, this guy right here?
Sure. Well, the physician-in-chief plays an absolutely critical role in the Cancer Center because, in large part, it's the major liaison between the scientific aspects and research aspects of the Cancer Center and the provision of clinical care. And one of the most important jobs that the physician-in-chief has is to make sure that, we have a world-class clinical program that is on the cutting edge of care for our patients, and that's essential to making sure that our research program functions well and is integrated within that clinical program.
So Dr. Holzerlein, none of this I'm sure is news to you. You know what's expected from you. What are you most excited about taking on this new role?
Yeah, so I think that obviously comprehensive cancer center status was a really exciting time. And how do we leverage that to continue to build on the successes that we've already had? And I think Dr. Jensen said it really well. I feel like one of my major goals and things that I'll need to accomplish is how do we continue to protect the academic mission? particularly when there's a huge focus on clinical productivity and clinical excellence, we want to leverage that to continuing to expand our research as well. And so really making sure that that mission never gets lost, and then making sure that we have people that have the opportunities and tools they need to continue to engage in research.
And you're not letting Dr. Suey off the hook just yet, right? He's really helping with this transition, correct?
Absolutely. I mean, as anyone knows, Dr. Suey has been a fantastic mentor during this transition. Was a mentor really throughout my career. We've been both at KU. He was here obviously before I came, but for the 20 years that I was here prior to taking this position, Dr. Suey and Dr. Gerard were both great mentors to me, and he's continued in that role.
And what's it feel like to hear that, Dr. Suey, and to hand off this job to Dr. Holzer?
Well, like I said, retirement's been a great transition for me. I do miss a lot of aspects, but I also am very excited about the future of not only myself, but for KU as an organization and the Cancer Center and its patients. It's, couldn't be left in better hands with Dr. Holzer. Like Jeff said, I've known him since I think the first day that he arrived at KU, and gotten to know him and see him rise in his leadership. And boy, the KU Cancer Center couldn't be in better hands with his new leadership as the physician-in-chief. And it's always great to have fresh eyes and a new perspective. And I'm really excited to watch and see what the next level is going to be like.
So, Dr. Jensen, we know there's a lot of impressive doctors that work here, but how did Dr. Holzer, how did he rise to the top?
When we advertised nationally for this position, once Dr. Suey had announced his intention to retire, we had an incredible response to that. And, frankly, that was gratifying to quite a number of us, because we had people from some of the best cancer centers across the world apply for this position. And what became clear in that process was that Dr. Holzer was able to articulate a vision for, really the 21st century of the KU Cancer Center, and how we build our clinical program and integrate, world-class research aspects into that clinical program. And, it really came down to the fact that I think he was someone who deeply cares about this institution, and at the same time was able to express a vision that was really second to no one in that applicant pool.
So, Dr. Holzer, and this is one of those reasons, because you're involved in so much research, and I want to kind of go down the line so that folks know exactly what you're involved in. We're not geniuses, so you're going to have to kind of talk to them in my terms. Talk to them like you're explaining it to me. So you're working on a couple of projects, like an immunonutrition trial. What is that?
Yeah, so one of our major goals is to sort of decrease morbidity, which is, complications and things that maybe debilitate patients around major surgical procedures. And one of those is bladder cancer. So Dr. Jill Hamilton-Reeves and I identified a problem with these patients really losing a significant amount of weight, which puts them at risk for infections and all sorts of other complications. And so we started a trial that is now a multi-institutional trial across the United States, looking at giving a supplement that has added ingredients, arginine particularly, and some dietary nucleotides that can help modulate the immune system and reduce infections.
So what about this preoperative drink that could prevent low blood sugar?
Yeah, so that's another thing that we've been working on, again, to try to improve surgical outcomes. And so one of the things that we know is that patients don't get to eat or drink before surgery. And so they go into surgery already having depleted their glucose stores, and that is not good for patients. That also can lead to reduced immune function, increased infections. So what we're looking at is giving a drink preoperatively that would be broken down much slower. It's actually used oftentimes by endurance athletes that are running 100-mile races.
That's what I was thinking of when I read that.
And we should view it that same way, I think, is that this is sort of an endurance endeavor. So we're studying the utility of that, particularly in terms of how insulin responses go and then some of the immune function around that.
You'd mentioned bladder cancer. Tell me about the heat shock protein 90. What's that?
Yeah, so heat shock protein 90 is a protein within cells that is responsible for stabilizing cells when they undergo stress. And cancer is obviously a stress state. So we have been looking at whether if we can inhibit this protein, that might cause cells to undergo cell death, and particularly cancer cells might be more susceptible to that. So we've had a drug that we've been working with a medicinal chemist on that can inhibit that protein, heat shock protein 90, that may lead to cancer cell death, and we've been working on that in bladder cancer. And
what about some new wearable technology? Are we talking about like Fitbit, Apple Watch type of thing?
Yeah, so one of the things that I would really love to do in my new position is try to leverage some of the great things that we have going on in Kansas City, and obviously Garmin is one of those things. And so we worked with Garmin to develop a project where they had a wearable, and we helped monitor patients after surgery to probably try to identify if patients were getting ready to get sick or have a complication. That might be manifested in their steps. It could be manifested in their heart rate. So leveraging some of those technologies and some of our local companies to help us improve patient care.
So you're kind of busy.
A little bit.
A little bit here and there. Okay, so this is so fun. I worked on this story with you almost 2 years ago, Dr. Holzer, and you did something that certainly none of colleagues around here had done, but I think you may have been the first person to do this that we've heard of.
As far as we know.
As far as we know, and you got a little bit of veterinary experience. So back in 2021, the Kansas City Zoo called on you and your team to operate on a 400-pound gorilla. The gorilla's name is Curtis. He needed its kidney removed. So how did this all come together?
Yeah, so Dr. Carrie Winnicky, who's the chair of OBGYN, is on a Facebook page with a lot of women physicians around the country, and reached out. She got a notification that said, would anybody consider doing a nephrectomy on a gorilla at the Kansas City Zoo? So her husband is one of my partners, Dr. Josh Broghammer, called me that morning and said, would you consider this? And of course my response was absolutely.
Yeah, you had no hesitation.
No hesitation.
So why was that? What was it just? I mean, what a fascinating experience.
Yeah, I think the opportunity, one of the things I think that is great about opportunities like that is really, assembling a team and community and going out and doing something that is a little outside your scope, but continues to sort of, challenge you in terms of what brought you to medicine in the first place.
Well, and I think you said it's not lost on me with all these fancy titles, all this research you're doing. You said this is probably what my kids will remember me for, and this is the story that my kids are going to tell when it comes to Dad, right?
Absolutely. I mean, I think that it sometimes gets lost, that you take care of patients all day, and that we do a good job of that here. But we kind of almost make that routine, and so this isn't routine, and so I think that's what makes it exciting.
And it was just a good community collaboration with the zoo and all the people that came together. It was pretty cool to watch. It was. So, but how does gorilla surgery compare to human surgery? What was the same? What was different?
So it's really remarkably identical. The anatomy is very similar. The only real major difference, obviously the skin is different, very tough. And then they have a lot of bowel gas. They eat a vegetarian diet, which creates a lot of bowel gas. So getting the colon out of the way to get to the kidney, a little bit challenging.
I would say so. And you also said they have no fat?
No fat.
No fat.
No fat at all, yeah.
But how big was that bad boy when you pulled that out?
It was huge. I mean, it was bigger than a football.
Yeah,
so about
and you were elbow deep down in there.
Yeah, maybe almost shoulder deep.
Shoulder deep, yeah. You put some muscle into that, little sweat there. Dr. Jensen, let's bring you back in here. Since you've been in charge of the Cancer Center, it has earned recognition of being Comprehensive Cancer Center from the NCI, the National Cancer Institute. You were working very hard. It's almost like nobody saw you for so long as you were in there working on this designation and writing up all those papers. How proud of you of that designation, and what does it really mean for patients?
Well, mostly I'm proud of the team, and it was literally dozens, if not hundreds, of people that worked on designation. And Part of the fact that you didn't see me, of course, was COVID. And we had to put together our application and actually have our, quote, site visit in the middle of the COVID pandemic. And so it was a virtual site visit. And that presented a number of challenges. But it was great to kind of review all of the things that have happened over the last 20 years and put that into our application. And a lot of great things have occurred at this institution over that period of time. And you could take out a number of those events, and it probably would have led to us not getting comprehensive. So it's been a regional effort, an institution-wide effort, and I think the entire institution should take a lot of pride in this.
They do, and thank you for leading the way on that. But we talk about proof of outcomes for patients. We say that a lot on this program, that people who come to an NCI designated cancer center, they have better outcomes when they get second opinions. Tell people a little bit more about what that means and why they need to ask those questions about NCI.
Sure. So there's been a number of studies published in the literature now that have looked at the outcome of cancer patients who are treated at NCI designated comprehensive cancer centers versus elsewhere. And the results have been quite clear and very consistent. And that is that, frankly, patients do better at an NCI designated comprehensive cancer center, and I think there's a number of reasons for that, one of which is we have the luxury, quote unquote, of having a very high patient volume. And so our physicians are not only world-class clinicians, they also have tremendous experience. And so when we talk about, say, our surgeons and doing pancreatectomies, they do these pretty much every week. It's not a once or twice a year type of thing. And so they have tremendous experience. Another issue is access to technology. And you don't have to go any farther than our new proton unit, which is the most technologically advanced proton unit in the world. To make that point. And the other thing is that frankly, our physicians have such a volume of patients that they can be highly specialized, and so they know exactly what the standard of care is for pretty much each and every patient that walks in the door. And oftentimes we're involved in research projects that are attempting to extend and improve that standard of care so we can offer those patients a clinical trial. And it's well known that patients on a clinical trial do better than those that are not, simply because of all of the attention that those patients get in the strict adherence to even those folks on the standard of care arm.
Dr. Suey, what advice do you have for Dr. Holzer as he takes over your new job, as you sit by the water and relax?
Well, like I said, Jeff's and my relationship has been pretty much career long, and so it's been a pleasure to watch him develop. I've told him all along to really have kind of tourist eyes, to really look at things with a fresh and new perspective, and to really to continue to develop the people underneath him, and then really then get out of the way and watch them lead successfully, which has been a really successful model we've had in the cancer center, and he's the right person to do it.
So, and as we know, Dr. Holzer, good leaders help people around them. How do you plan to help those around you and lead the way?
Well, one of the things, and I think Dr. Jensen alluded to this, is that as I've sort of taken over this role and started to meet with people, the talent and the things that people are doing around here are remarkable. Mm-hmm. And that's exactly why we got NCI designated comprehensive cancer center status. but I don't think we always know all the things that we're doing. So one of the things we're trying to do is make sure that we do a good job of telling that story, right? Of letting people know what are the remarkable things that people are doing. So, helping to make that more public is one of the things I really am trying to accomplish, so that everybody knows what people are working on. I think that fosters collaboration, it fosters reputation, all of those things go along with that.
So here's a question for all of you. What's most exciting for you when it comes to the future of cancer treatment, the near future? Dr. Jensen, I'll start with you.
Well, I would say we're in the middle of a revolution right now, and that is the adoption of immunotherapy as really frontline treatment for many of the cancers that we face, and the tremendous success that the various forms of immunotherapy have had in a wide variety of cancers. And this is simply a game-changing moment, and we're seeing responses in patients that formerly, we really had nothing to offer them. And that's incredibly exciting, and it's completely revolutionized our treatment of melanoma, of non-small cell lung cancer, and a number of forms of leukemia and lymphoma.
Dr. Suey, same question. What excites you?
Yeah, I just tag on a little bit what's been said earlier about technology. Again, the new proton center is about a year old. I think they've done greater than 100, helped treat greater than 100 patients, and there's some new protocols now coming on that even allow even shorter treatment times than what was initiated a year ago, so that patients can get really back to what they want to do and stay out of the hospital and spend more time with family and friends during that important part of their journey.
Dr. Holzer.
Yeah, I mean, certainly echo both of those things, and I think one of the challenges, but one of the exciting things is as we change cancer to a chronic disease as opposed to a lethal disease, is supporting patients throughout that entire journey. So from the diagnosis to survivorship, making sure that as patients are living longer, they're living those productively. And so it'll be really important, I think, and I mean, many of our top programs look at things like survivorship and how do we support patients throughout the cancer journey. So I'm really excited about continuing to build on that.
Be sure to ask your questions. You can use the chat on YouTube or Facebook. You can tweet us or email us at the Medical News Network. That info is right there on your screen. Let's get a check on our COVID count. Dr. Dana Hawkinson joins us, Medical Director of Infection Prevention and Control. Good morning.
Hi.
Hi.
Yeah, right now the cases, still fairly low, but we need to go lower for sure. We are at 41 total cases, 26 active, but again, high proportion with severe illness, 6 in the ICU and 4 on the ventilator as well.
So the newest COVID tracking data from the CDC shows 0 Kansas counties have high community spread. Now, just 2 weeks ago, 3 counties on this map were in the red, but that changed last week. So now it's green and yellow, although the counties closest to Kansas still have a medium community spread. Is this overall good news?
Yeah, I mean, I would say it is good news, but just as we showed on our COVID count, there is still the virus circulating, especially for those that are high risk. There is still activity and circulation of the virus. SARS-CoV-2 causes COVID-19. We still are getting severe illness. And we know that this data, there are significant caveats to this data, such as the number of testing sites. Reporting. We know that people may not go get tested or maybe doing at-home testing. So there are caveats to that. We know in some of the markers that the CDC uses, certainly hospitalizations are one of those things, and we are really using that as probably the best bellwether for circulation of the virus because it impacts healthcare. It impacts healthcare to that person, but it impacts healthcare across the health system as well. So overall, it is good news. It's much better than it was. We are gaining that population immunity. Individually, you are gaining immunity with vaccinations and or infections, but especially for those at highest risk, the virus is still out there. If you are at high risk, please be up to date with your vaccines. Also take those extra precautions to keep yourself safe. If you have symptoms, get tested early. get on Paxlovid if you're able to, talk with your medical teams. Those things will help prevent you from having to come to the hospital.
Any reporters with us today? Let's get to our community questions. Kyla wants to know, Dr. Holzer, will you still be seeing patients? You sound super busy, but what about those patients you've been serving? Are you taking on new ones?
Absolutely. Being a physician, being a urologist and a urologic oncologist is sort of the core of what I am. Okay. And I feel like it's important to continue to have a clinical practice so that you understand challenges on both the provider as well as on the patient side.
You're just going to find a few more hours in your day somehow, some
Absolutely.
way. And you're going to be more of a frequent flyer on this program.
I'm looking forward to that.
I already have you booked next week and I think a couple weeks from now. So just, hang tight. That's how you're going to start your day, right here with me. Casey wants to know, how long does NCI designation stay, Dr. Jensen? Is this something you have to keep resubmitting for? How do you keep it there?
Yeah, so they're actually kind of like lease agreements. They're not birth certificates. And so every 5 years we have to renew our designation status. And so that means that about 4 years from now, we'll have to go through the exact same process.
Okay, good to know. Question from Mary is, what did Dr. Holzer mean when he said protect the academic mission? What is the academic mission and why does it need protecting?
Great question. So the academic mission, we're at an academic medical center. As such, our core principles are to provide outstanding clinical care, to do research, to do teaching, and have positions of leadership. And I strongly feel that leaders need to continue to promote those activities in an academic medical center. And we can't lose sight of those core missions of an academic medical center.
Jeremy wants to know, Dr. Holzer, cancer, it's such a terrible thing, but it seems like cancer doctors are such kind and positive people and genuinely excited about their work and their patients. What is the part about your work that's so incredibly fulfilling?
Yeah, for me, and one of the things that's a little bit unique potentially to urologic oncology are lifelong relationships with patients. So I continue to see patients. I have patients now that I've been seeing for 20 years and building those relationships with patients. So as we get better and better at curing cancer or controlling cancer, having those patients continue to come back and develop relationships with those patients has been incredibly rewarding. And
is it a requirement to wear a bow tie in this position? Because I know Dr. Suey used to wear his bow tie, which I loved, but you've got yours.
Well, I think if you think about what a urologist does, we really should be wearing bow ties. So, I've worn a bow tie as long as I can remember, mainly because I don't want my tie in places it shouldn't be.
So that's a professional choice.
Absolutely.
I love it. Okay, thank you for really, I thought you just had really good style. You're just really a smart guy. All right, let's get today's takeaway. Dr. Suey, I'm going to miss seeing you at Costco.
Miss you too.
I know. So you gotta hang out with us more. But give us a takeaway today. What do you want people to know?
Well, it's like Dr. Jensen and Dr. Holzer have been saying, things are moving at such a rapid pace, and we're so optimistic about how this dreaded disease will become a thing of the past. And so, and I think that's going to be happening here for many, many cancers in the near future. Lung cancer in the last decade has had significant changes. So something really to look forward to. Keep in tune with your doctor, get your prevention, and find things when they're small, if they are there, and do everything you can to prevent cancer. And I think we're going to see a whole different type of society now than we have in the past. Very exciting.
Thanks for being with us up and early. We appreciate you. Yeah, Dr. Jensen, screenings are everything. Final takeaway.
You've already alluded to the fact that our cancer center will have to get redesignated in the next 4 years, and that one of the criticisms that we faced was the fact that we're spread out all over the place on this campus. In fact, the cancer center is in 12 different buildings. And one of the most exciting projects that we have ongoing right now is planning for a new signature cancer center facility that we hope will bring together our research and clinical programs under one roof. And this facility will define the KU Cancer Center for much of the 21st century. And that's an incredibly exciting initiative, and we're really looking forward to making that happen.
Well, we will be watching. Dr. Holzer, congratulations.
Thank you.
Thank you for being with us today. Final takeaway.
Yeah, I'm really looking forward to sort of the next step in leveraging this comprehensive cancer center status. And I think, as Dr. Jensen mentioned, you can't really overstate the collaboration that we envision in this building, and co-localizing researchers and making sure that as we try to bring clinicians together, the power of their sharing and what they're going to be able to accomplish through that, I think, is going to be great.
Great. Guys, thanks so much for being with me today. Dr. Hawkinson, take away.
Yeah, I just want to echo the comment about the medical and academic mission at the University of Kansas Health System here, also with the University of Kansas Medical Center. Provide that excellent clinical care while also continuing to do leadership and teaching for the next physicians and care teams to come through as well, and have no better teachers than we have seen right here on the show today.
No doubt. Thanks to our guest, and thanks to our viewers for being with us today. Have a great one. We'll see you back here tomorrow at 8. When chemo wasn't working, doctors turned to a blend of 2 remarkable therapies, CRISPR plus CAR-T. I'm Jessica Lovell on the next Open Mics with Dr. Stites. Meet a woman now in remission and explore the science that lets doctors train the immune system to exterminate cancer. Wednesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.